Patient-centered medical home is a way to integrate medical care to patients, adding in their emotional aspect, their mental health aspects, and collaborating with multiple disciplines.
It is a recognition that the old model where the practitioner was the only one responsible for the patient is outdated, and that we need a team approach to taking care of patients that involves pharmacists, RNs, medical assistants, so everyone can work to their highest scope of practice.
Incarcerated will get a much better experience in terms of medical, mental health, dental. We're all going to work as a team. We all speak to each other. We all intertwine together. So the idea is that they're going to get the full circle.
So much about care is the relationship with the people that provide it. And so this concept of shared decision making between a patient and their healthcare team is really very important.
The overall goal of patient-centered medical home is to arrive at a place where the people that we care for are healthier Washingtonians. We really believe that prison is an opportunity and a time for people to really invest in their own health.
This type of model really helps establish and foster a positive relationship between the provider and the individual that really focuses on the needs, the overall whole person needs.
Back in 2019 and 2020, the annual report from the Office of the Correctional Ombudsman identified health services as their #1 concern of the agency. In fact, their #1 concern was care delivery, access to care, and patient outcomes. So the agency contracted with a national expert, Dr. Homer Venters, to come in and assess our system. Through his assessment, we were able to identify changes to our care delivery that would have a positive impact on patient care.
The Patient-Centered Medical Home project has been designed to involve as many people that deliver care as we can. During our workshops, the people that deliver the care are the ones that actually identify the processes that need to be changed, the way they do their work.
A lot of these changes are happening to increase patient care, minimize medical emergencies. When an incarcerated individual declares a medical emergency, it pretty much stops all operations in the facility. It mitigates programming, it mitigates recreation time, it cuts into the main lines and really kind of slows down the processes. And sometimes things get missed because of these medical emergencies.
The model we had before was based on people being ill and then taking care of that illness. And what we've done is we've taken an approach to really emphasize prevention and emphasize really taking care of people proactively instead of waiting for them to get sick and then doing something about that. The wheel and spoke model is the visual that helps you to understand that the patient is at the center of everything that we do. The patient actually decides who their circle of support is that surrounds them. It may be their classification counselor in their unit, it may be a peer or a friend, it may be a loved one who is at home. It almost certainly will be their patient-centered medical home primary care team, and it may also include people like their dental staff, their mental health team, and community partners.
What excites me about this model is that the focus is patient-centered. And we could play lip service to those words, but this model brings to the table how to take these principles and bring them into fruition.
Just like a couple months ago playing basketball, I hurt my knee, so medical actually came out and got me and helped me out on it. And at the same time, when I get into medical and they're helping me for my knee, they help me for a brace on my hand because I just had surgery on my hand too. Just them, going the extra mile like that, instead of telling me, no, you gotta put a kite in for this, a kite in for that, all separately. They was willing to help me out on all my needs right there.
There was a patient who, he's in a wheelchair. I thought about him and how difficult it would be on him to have to come back another time simply to get his labs drawn or to receive a vaccination. I said to him, why don't we get all of those things done while you're here right now? He said, yes, thank you, that would be amazing. No one has ever thought about me and how difficult it is for me to get around.
It's going to change our culture. We will be very focused on the patient center of everything.
I think it's really going to improve their experience because when people feel like a team is working for you, you feel better about your care.
People I tell, man, take advantage of it because you guys got it made up here in Washington State. You know, with medical, with mental health, it's actually excellent to me.
Prisons have been around for many years, and we need to grow with society and how things are moving along within the prison systems, and that starts with, you know, us making cultural changes.
Unfortunately, in there, you know, I'm sure, you know, some patients didn't get the best care that they could have, not because nobody wanted to give it to them, but just because the model that was in place at that time didn't support that.
One of the other components of this care delivery system is a whole segment that is devoted fully towards quality management and improving the quality of care that's delivered.
Once people understand the process, I think is a very good process of delivering care. I think there are facilities that really need this project, and I think all DOC facilities will benefit from it.
What I would like to do is commend the staff of the Department of Corrections Health Services Division for taking on this daunting task of changing the service delivery model for how the department delivers health care services.
Change is hard, but you have to believe. It takes time, it's stages. We're all overwhelmed initially, but when you see the positive impact that you're having and how much of an impact it has on you as a person who's trying to give care to patients, you'll see the overall positive reinforcements and changes that are happening as a result of it.